are not ideal. You're not going to go under your patient's torso and then just lift them all the way up and then have sensitivity. So what we do is we try and just get a sense of the movement that's available in the lumbar spine, in particular thoracic. Can you slide towards me a little bit? So you want the patient as close as possible. You want to minimize the amount of work that you have to do, so can you flex your hips? Okay, here, now relax. So here, now I have the weight, and I use my body movement, and I keep a straight spine, and just use this body movement. Once I feel that I have the weight of their lower extremity, I can now walk forward. Any pain, feeling for any limitations, seeing that they get, adequate range of motion, okay? If the low back is locked up, they're not going to be able to do that, okay? So extension of the spine, can you turn over? This is the one where I could go under their legs and lift them like that, but it's really heavy to do that, right? I can go like this and lift. It's invasive and heavy to do. So one of the things that I've observed over the years is just really relying on palpation, observing and seeing if the patient has the range, and then using palpation. So I'll ask them, can you go up on your forearms and push yourself into extension? Okay, good. And then just relax. All right, so they relax. I'm evaluating. I can feel for the movement. Can you push up on your hands? Okay, push it into extension. Right, and they're relaxing as well. So palpate, have them push up. Forearms can be enough. Okay?
Rotation and lateral flexion.
Can you turn on your back? So for rotation, same thing. Start with your knees up. So I'm going to hold at the tibial tuberosities. I can lean forward, right? 90 degrees of hip flexion. Now, I just use my footwork to just back off a little bit and guide the legs into rotation. Here. I'm not going to rotate to the opposite side across the table. Mm-hmm. I'm going to hurt myself if I do that. So I'll go across, do the same thing, keep my back straight, take a step out, and just guide.
Theoretically, potentially start to climb off the table.
Yeah, you don't want to do these movements quick. You don't want to do it in a way that they're going to be compromised or fall off the table.
Okay, and lateral flexion.
All right. Sorry, I'm going to...
Need to move.
Yeah.
Need me to move?
It looked like,
It's
it's like they found it in the pyramids, and somebody's been sleeping on it for thousands of years.
That's all the yellow spit. Ancient spit.
And that's the ancient yellow.
It's the head sweat of 1,000 massage therapists. Here, I'm just gentle traction, just getting the legs off the table, and I'm moving them together as a unit, right? What I'm doing is I'm observing that movement, that lateral flexion in the spine, okay?
Cervical spine flexion extension.
Just, again, a reminder, all of these would be bilateral. Assume that you're going to do all of the tests bilaterally unless I tell you, good, we're moving on. If I say good, it means you did it correctly. If there was a minor deduction, I'm not going to make you do it over again, a minor deduction. But if you did something wrong, I will always repeat the test. So if I say, can you demonstrate active flexion of the shoulder, and you do the test, and I say active flexion of the shoulder, that's your one cue. And so take your time, just take a deep breath, and then see if, ooh, yeah, I lifted their leg. So instead, go to the shoulders. All right, cervical flexion, you said?
And extension.
All right, so active cervical flexion. I want you to have good control. Things that we're looking for the test so that you're not covering their ears. If you have earrings, okay, so if you like to wear big earrings or hoop earrings or anything that can be obstructive or get ripped out of an ear, please don't wear it next week. it is your responsibility as the person who's testing to ask the patient, can you remove your earrings? All right. This is very important. So here we're holding, we're not obstructing. I'm going to keep my elbows connected, my arms connected to the body. I'll ask the patient to take a deep breath, breathe out, and as they breathe out, I lift into flexion. So as you continue, you can change the direction of your hands. Okay. First, I'll show lateral flexion. Again, slide off to the side a little, bring the head to one side, bring it back. For rotation, same thing, using the two hands together, right? Rotation. For extension, which I'll demonstrate, but extension, again, not going to be on the final exam because I don't want, you're taking your test, you pull their head off and you drop their head and, yeah. We have our passports ready for next week. All right. Can you slide back? Okay, good. I go off to the side. My feet are firmly planted. My arms are connected with my body. Take a deep breath. Breathe out. And I lower into extension. Okay, slide back. You don't want to, when you lower somebody in extension, just in your practice, don't have your face right there. This isn't Spider-Man. Okay? You're not Tobey Maguire.
No way, serious.
All right.
Not funny.
That's a violation. Right? This is important. Number one, one of the most common boundary violations that massage therapists make is they forget that the patient is here, and they're working. Okay. Can you sit in the chair? So for shoulder flexion, again, you can demonstrate it on the table. You can demonstrate it theoretically standing sometimes. If I'm 6'5", my patient is 5'5", I can stand, and theoretically I could have really good posture and fully flex the shoulder. For most people, what I would recommend is you have them sit in a chair, ask them to put their feet flat on the floor, right? I'm going to go here, I'm going to grab the arm, and now I can lift and I can passively flex. Okay. In this position, can you slide towards the edge? Yeah. In this position, then I can go straight into passively extending. When I passively extend, I want to position myself behind, keep my back straight, and then I can stabilize the scapula. Otherwise, they're going to retract also, and the spine is going to rotate. So if I just gently depress the scapula, now I'm isolating the glenohumeral joint, moving into extension. Okay?
Abduction and adduction.
Can you lay on your back on the table? Here, I have the arm, and I can walk the arm 180 degrees into abduction. Now, that is also a test that we learned. What stretches that? Very good. Latissimus dorsi or teres major. What's the key to remember with latissimus dorsi? Palm is always facing up. So if you know it's the stretch for latissimus dorsi, you start with the palm up like this, and now you're externally rotating as you abduct. So this is the stretch for that. But this is also passive abduction, right? If I want to passively adduct, I can move the arm across like this. Any pain? Okay.
All right, horizontal abduction and adduction.
So again, horizontal adduction, horizontal adduction, we're always thinking about, like, you can flex the elbow, right? You don't have to worry. But what I like to do is just grab at the wrist, grab at the elbow, and bring this across, straight across.